Good morning, students. Today we are going to discuss the points of criticism in Kant's repertory or mistakes in Kant's repertory. So, after publication of Kant's repertory, many repertories were there and many other existing repertories, were used less and less because Kant repertory, which contain all general symptoms as well as particular symptoms, and also in this repertory it contains many rubrics, large number of rubrics as well as remedies. So many of the physicians, after publication of Kant's repertory, they used this repertory only, and the other repertories, the use of other repertories was decreased because of completeness of Kant repertory. It is Kant repertory, the work is very much elaborate, and naturally some mistakes are bound to occur. And we now discuss which mistakes or which points are lacking in Kant repertory. So the first point is, in Kant repertory at some places, general rubrics themselves do not represent the name some medicines and which are mentioned in the sub-rubric. When you go through the repertory in section Mind, in that if you open the rubric Delusion, in the delusion rubric, in front of delusion rubric or any rubric, group of medicines, general medicines indicated to that rubric are given. In the same way, there is group of medicine, and in that group of medicines, Drosera was not mentioned, but when we go through the sub-rubrics of rubric Delusion, for example, persecuted, that he is, we found there is Drosera medicine in front of sub-rubric of Delusion, that is persecuted he is. Then there is other sub-rubric of Delusion is fancy, illusion of. In front of this sub-rubric of rubric Delusion, Drosera is there. Then delusion is the rubric, its sub-rubric images, phantoms, see. In front of this sub-rubric also we found the Drosera medicine, and the other sub-rubric, another sub-rubric, that is longer things seem. In front of this sub-rubric also, this sub-rubric of rubric Delusion, we found Drosera. So in such way, under many rubrics, some important medicine which is not given in general group of remedies in front of that rubric, but it was given in the sub-rubric, sub-rubrics. So this is the main mistake which is taken place in this repertory. Then the second mistake is, or the second point of criticism is, as we know, Dr. Kant, he doesn't accept the philosophy of Dr. Boning Hussein. He was the great critic of Dr. Boning Hussein. He doesn't follow his philosophy as well as he was against his philosophy of complete symptom, as well as we should give importance to the organs, particular symptoms. But in his repertory, he could not avoid the use of such rubrics. For example, liver, spleen, affection of heart. These rubrics we found in Kent repertory. They are related to organ or part of the body, and he was against to give importance to part of the body, as we already discussed in his philosophical background that man is prior to organs. We should never give importance to the part or organ or disease condition, but we should consider the man as a whole. And so, as Boning Hussein considered the parts, organs of the affected part or affected organ of the body, so he was against his concept, against his philosophy. And then also there are some rubrics which are related to body parts or organs. In his repertory we found such rubrics, and the examples are liver, spleen, affection of heart, etc. Then he also against the concept of clinical prescription or clinical rubrics, as same as he was against the concept of, or he was not accepting, he was not following the concept that the part or organ is sick. In the same way, he was also against the concept of clinical rubrics. So in his repertory we found many clinical rubrics, though he was against the clinical rubrics, against the means we should not prescribe according to the clinical condition, though then also in his repertory which contains many clinical rubrics, and the clinical rubrics such as pneumonia, pulmonary edema, anemia. These rubrics we found in Kent repertory, though it do not serve the purpose of repertorization according to his philosophy. We do not consider the clinical rubric, or it does not serve the purpose of repertorization according to Dr. Kent. Then also we found many clinical rubrics in his repertory. For example, pneumonia, pulmonary edema, anemia, etc. Then we discussed earlier that which is the largest section or which is the largest chapter in Kent repertory, and that was the extremities chapter is the largest chapter in the Kent repertory, and it was too much elaborate chapter and no need of such details while repertorizing. When we repertorize the case, there is no need of such details of the symptom. So extremities chapter is the largest in the repertory but is least useful for the repertorization. It is very less useful for the repertorization, very less useful in such depth for the repertorization. There are many similar rubrics we found in the repertory, and it was very confusing for the beginners. and many times such similar meaning rubrics, it causes many difficulties when the beginners they are going to repertorize the case. So which are the similar meaning rubrics in the repertory? For example, fear, timidity, frightened easily. The meaning of all these terms is same: fear, frightened easily, timidity, but they are given at different places in mind section with different group of remedies. So in front of fear there are some remedies given, in front of timidity the other group of remedies given, in front of frightened easily some another group of remedies is given. So there is the group of remedy which are given in these rubrics, though they are similar in meaning, it is difficult. It is different. So it is difficult for the beginners to choose the rubric from all these similar meaning rubrics. And in some places in such similar meaning rubrics we found slight differences in drugs. For example, do not want the doctor. For this symptom, some rubrics found in repertory are well, says he is. Then delusion, well, thinks he is. In irritability also we found the same symptom, irritability, sends the doctor home, says not sick. Then obstinate, declares nothing matter with him. So the meaning of all these rubrics is same, but the medicines indicated for each and every rubric is different. So this is the example that many similar rubrics or similar meaning rubrics, they appear at different places in the repertory. It may be in the same chapter, in the same section, or in different section, but the remedies indicated for each rubric with the similar meaning, it is different. As we know, modalities, the main qualifying factors with which are given, the modalities which are given with very minimum number of different group of medicines in general rubric and in sub rubrics. So modalities with least different group of medicines in general and general rubric and in sub rubrics. Then some general modalities, they are mentioned in generalities and they also appear in parts. As we discussed earlier that some rubrics, they are appeared at two places in the repertory which is having the similar meaning. In the same way, some general modalities which should be mentioned in the generalities and it also appear in the parts. First we have discussed the examples which are in the same section, which are in the section mind, but these examples, as we found the similar meaning rubric, but they are in different sections with different group of medicines. For example, wetting feet aggravate. This rubric we found in extremity section, and in generalities, wet feet this rubric we found. So the rubric is same, but it was placed in different sections or different chapters, and it was given with a separate or different group of remedies. Then, as Dr. Kent, he introduced many things to the homeopathy. In the same way, he used nosores frequently in his practice. But in his repertory, when we go through the repertory, we do not found the nosores, and under many rubrics where it was indicated, then also we do not found the nosores under rubric. So though Dr. Kent used nosores in his practice frequently, but some of the nosores are found scattered under some rubrics, but they are not represented well. So they are scattered under some rubrics and not represented well. They are not mentioned properly every time. In under some rubrics we found their nosores are mentioned there, but not every time when it was indicated. It was not represented well. Then in the mind section, there is, when we go through the mind section, in mind section there is maximum number of rubrics we found in the mind section. So there is over generalization in mind section, and in extremities section, though it is the largest section in the repertory, but it was too elaborate section, so there is over particularization in the section extremities, and these both, they are not useful for the repertorization. Means over generalization in mind section and over particularization, especially in extremity section, they are not useful for the repertorization. Then under many rubrics, we found the omission of drugs. Though these drugs are, we found that symptom in the materia medica under that particular drug. Some drugs, they are strongly indicated for that symptom, but under many rubrics we found omission of such drugs. As for example, if faintness is the rubric, then faintness menses during, if you go through the repertory, faintness menses during, in front of this rubric, cyclamen is not mentioned in the repertory, but we found faintness menses during this symptom in the materia medica under cyclamen. So many rubrics suffer from omission of drugs, though they are found in the materia medica, but they are not given under that particular rubric in the repertory, or it was by mistake, it was get omitted. In mental rubric, It has a single remedy which cannot be used for repertorization. In front of many rubrics in the section Mind, we found only one remedy, and for repertorization purpose it is not helpful, as if you go through the repertory, if we go through the repertory, then in front of rubric consolation amelioration we found only the medicine pulsatilla was given. Then in front of rubric restlessness company in, we found only the medicine carbovage. Then in front of the rubric restlessness conversation from, in front of this rubric we found only the medicine ambra. In front of restlessness drinking aggravate, we found only crotalus. So in this way, restlessness storm before, we found only the medicine soranum. In this way, in front of many many rubrics, especially in mind section, there was only one indicated medicine which was given, and it was helpless, or it was not useful for the repertorization. Such rubric we cannot use for the repertorization. Then Dr. Kent, according to his philosophy, he gave importance to the mental general, physical general, and then particular. So though he was giving importance to the physical, means general symptoms, and then he go towards the particular, then also in Kent repertory we unfortunately we cannot found any single rubric which can guide us in this respect, or which can give us the remedies which are hot and which are chilly remedies. No such rubrics, though as there is Gibson Miller's hot and chilly remedies in the editions, not in the original work, but in the further editions we found the Gibson Miller's hot and chilly remedies in the prefix part, as we discussed this also previously in the plan construction. But there we, in this repertory, though Dr. Kent has given much importance to the thermal condition, but unfortunately there is no single definite rubric which can guide us in this respect. Then many rubrics, they are not given in a simple or easy language, especially in the mind section. The language is somewhat difficult to easily understand. So in this way, there are, though this repertory is elaborate repertory, and so we found some mistakes naturally they are going to occur in such elaborate work. While writing such elaborate work, so these are some important points of criticism in Kent repertory. Once we revise all the points, there are 13 to 14 points of criticism in Kent's repertory. The first point which we discussed earlier is, in Kent's repertory, at some places general rubrics, they do not represent the medicine which are mentioned in the sub-rubrics. We discussed the example of delusion and its sub-rubric. Then, as he was the great critic of BTPP or Boning Hussein's philosophy, Boning Hussein's all the literature, but then also he cannot avoid the use of such rubrics which are related to the organs or parts. For example, rubrics liver, spleen, affection of heart we found in the repertory, as well as the rubrics related to the clinical condition also we found in his repertory, though it do not serve the purpose of repertorization according to his philosophy. And the examples also we discussed, which clinical rubrics we found in this repertory are pneumonia, anemia, edema. So in this way the clinical rubrics we found in the repertory. Then the extremities section, it is it is the largest section in the repertory, and in extremities section there is over particularization is done, and in the section mind there is over generalization is done, and they both are not useful for the repertorization purpose. Then there are some rubrics, many similar rubrics which cause confusion for the beginners. Thus, the repertorization becomes difficult for them. As we discuss the examples, fear, timidity, frightened easily. Then under some such similar rubrics, especially sub-rubrics, the similar meaning rubrics that appear at different places with a different group of remedies, and it makes the confusion in the mind of the beginners. So the examples also we discussed. This is all about in the same section, the similar meaning rubrics or similar meaning sub-rubrics. They came in the same section, but many times the similar meaning rubrics, they came in two different sections. This is the examples of such type of similar rubrics in two different sections with different group of remedies. We discussed that wetting feet aggravate we found in the section extremities, and wet feet we found in the section generalities. Then the modalities, it is the most qualifying factor, but it lists with different group of medicines in general rubric and sub rubric. Under modalities we found different group of remedies in general, and when we go towards the sub rubrics of any modality, then we found the different medicines under sub rubric. Then we discuss another point of criticism, that Dr. Kent, he was using nosodes frequently in his practice, and some of the nosodes we found scattered in his repertory, but they are not represented well in the repertory. They are not represented every time where they are indicated. Under many rubrics in Kent repertory, we found the omission of some important drugs. Though these drugs we found mentioned in the materia medica and they are indicated for that symptom, but we do not found that drug in the repertory. Then in Kent repertory, many mental rubrics or many mental symptoms which are given with a single medicine and which is not used for the repertorization. So many medicines they are given with a many rubrics they are given with a single remedy and they are not useful for the repertorization purpose. So we discuss the examples of the same point also: restlessness, company, carbovage, restlessness, storms before, soranum. So in this way only one medicine was mentioned in front of that rubric and it was not useful for the purpose of repertorization. Then Dr. Kent, he was given much importance to general symptoms than particulars. Then also we does not found the rubrics which give us the thermal state of the patient with the group of remedies in whole repertory. There is no single definite rubric which can guide us in this respect to found the thermal condition of the patient. So in this way these are some important points of criticism in Kent's repertory or some mistakes which took place in Kent repertory while writing down such elaborate work. In this way, we discuss introductory part of Kent repertory. We complete philosophical background of the Kent repertory, then plan construction of the Kent repertory, then special features and scope of the Kent repertory, and today we completed the point of criticism in Kent repertory. Now we discuss about some practical guidelines while using the Kent repertory. In the plan construction, how the rubrics, how the sections are arranged. In that section, how rubrics, sub-rubrics, they are arranged in a proper format. There is some specific arrangement in the Kent repertory, and in the same way in all sections, all rubrics and sub-rubrics, they are arranged in Kent repertory. But there are some important things, important practical guidelines for the beginners when they are using the repertory. There may be some confusing things, so these are some practical guidelines which are very much helpful, especially for the beginners during his practice. So desire and aversion. We found specific desire and aversion for food in the section stomach. These questions also asked in the oral examination, or in oral examination there is some marks for the rubric hunting, and in rubric hunting the examiner may ask to find out any desire for so and so food in all three repertories. then which section the student can open. From that we can able to understand how much knowledge about the repertory the student is having. So in the Kent repertory we found desire and aversion to food in the section stomach. Then food disagrees we found in the section generalities. Any food disagree, any food which causes aggravation we found under section generalities, not under section stomach. Also some rubrics related to the stomach disorders, they are mentioned under in the stomach section under disorder rubric. Then all the general modalities related to the whole body, effect of discharges like menstrual discharge or cough cold, then effect of weather on the whole body, we should found all these conditions under generality section. Then as we discussed, according to anatomical division, according to anatomical part, the rubrics related to that part are given in that section. For example, in plan construction we discussed that under head, then under head section it contains rubrics on all part of head, that is forehead, occiput, temple, vertex, brain, meninges. In the same way, the symptoms of neck we should refer in the chapter external throat or back or cervical region, because the symptoms related to the front part of neck, they are given in the external throat as goiter, glands, torticollis. Anterior part of neck, the rubrics pertaining to the anterior part of neck, they are given in the external throat section, and the rubrics pertaining to the cervical dorsal part of neck, it was given under the section back. So in such way we should refer the section to find out the symptom. Then the diagnostic rubrics, as we discussed the point in the criticism that some diagnostic rubrics or clinical rubrics, they are mentioned in the repertory. Diagnostic rubrics such as edema, anemia, they are mentioned in the repertory, and we should refer to find such diagnostic rubric, we should refer such rubrics in generalities section. Then the concomitant symptoms, we found the concomitant symptoms are scattered in the whole repertory. It should he referred to under the symptom in concerned chapters. For example, if during fever the hunger increased, then we should find out the hunger increased, this symptom under appetite. So in appetite increased, fever during. In such way the concomitant symptoms, they are scattered in the related chapters. Then in generalities the pain rubric, there is pain rubric. The pain rubric related to the extremity. It was in extremity section, the pain rubric is too much elaborate. But in generalities, the pain rubric which deals with blood vessels, then bones, glands, muscles, parts which are paralyzed, periosteum, small spots. So, in generalities, we found such pain rubric related to the blood vessel, bone, gland, muscle. In this way, the pain rubric is related to such type of pain rubric are we found in the generalities section. Then if there is symptom related to perspiration, then the sweat or perspiration on any single or any special part we found under that anatomical section. For example, if there is profuse perspiration on face, then in the section face we found the rubric under section face, rubric perspiration on. So in this way, under the anatomical section in which the part is located, we found the we found the rubrics related to perspiration or sweat. Then many symptoms, they are scattered in different sections, and at the same time they do not represent the whole group of medicine, or there is different group of remedies they are given. So in such cases it is necessary to refer all the related rubrics to know the number of drugs, so that we can find out a bigger group of medicines related to the same rubric. For example, if we refer the repertory, then anticipation complaints from, it was given in the page number 4. Then anxiety, anticipating an engagement, it was given on page number 5. Then anxiety when anything is expected of him, it was given in page number 6. Diarrhea after anticipation, it was given in page number 611. Diarrhea from excitement as before theatre, timidity appearing in public. So these all rubrics which is having anxiety, timidity, and the meaning of rubric in general is same. So we should consider the all medicines, we group together all medicines, and so that we can get a large group of medicines for the repertorization. Then first we discussed previously that any desire or aversion to specific food we should found under the section stomach. But if that desire and aversion is at mental level, then we found this desire aversion at we found the things referred to as things, desire and aversion. For example, work, aversion to mental. Then company, aversion for or desire for. Children, aversion to. In this way, we found the desire and aversion in the section mind. Then any sensation at general level which does not start with the word sensation, but it starts with the specific sensation. For example, coat of skin drawn over inner part, sensation of. Plug, sensation of. Water dashing against inner parts, sensation of. In this way, any sensation we found with the which starts with a specific sensation, the rubric starts with a specific sensation in the repertory, so that it is easy to find out the rubric. And the sensation related to parts, it can be referred to in a similar way under the parts concerned. For example, if there is sensation of a ball in stomach, or sensation of enlargement of eye, if there is sensation of ball in stomach, then under section stomach we found ball sensation of. If there is sensation of enlargement of eyes, then under section eyes we found enlargement sensation of. So in this way, these are some practical guidelines which are very much useful for the beginners who are starting their practice newly. For them, these guidelines, they are very much useful to find out the symptoms or to find out the rubrics in the repertory easily. So this all about the Kent repertory with its some practical guidelines. Thank you.